I look forward to working with you to continue to look at diversified Alzheimer's research. Wasteful spending of taxpayers' dollars must end, and I applaud you for taking a hard look at what federal research dollars are funding. And I encourage you to ensure that the fiscal year 2025 funding that Congress has already appropriated is spent in a timely manner, in particular for the vital biomedical research which could lead to life-saving breakthroughs in science. Too many families are waiting for a cure, as you know. We have a responsibility to make sure their taxpayers' dollars fund that research. You and I have talked several times, and I appreciate it so much, about the importance of the NIOSH coal programs in West Virginia and how the work conducted by NIOSH in Morgantown is unique across the federal government. I'm pleased that you brought some of these specialized NIOSH employees back to work earlier this month and then just last week reversed their rifts so that their return to the office will not be temporary. Thank you. Your decision to return NIOSH staff to the office meant that the Firefighter Fatality Investigation and Prevention Program could issue the final report on the December 27th, 2020 fire that killed a 30-year-old firefighter and injured 3 others in West Virginia. Senior Airman Logan Young was one of many who responded to the Carneysville fire. I'm glad NIOSH was able to finish their investigation and issue recommendations and final report. While your action last week was a good step, there are still other divisions within NIOSH with specialized staff who conduct essential, unique work. I support the President's vision to right-size our government, but as you and I have discussed, I don't think eliminating NIOSH programs will accomplish that goal. I encourage you to look at this closely. West Virginia, my own home state, continues to rank above the national average in both new cancer diagnoses and death. We are thankful for the work performed by the CDC National Center for Chronic Disease Prevention and Health Promotion, and I look forward to learning more about how this important work will be continued under the administration of a healthy America. Substance abuse challenges also continue to be a real problem facing West Virginia and the nation. SAMHSA funding has played an important role in West Virginia, and I want to understand how the budget proposal would impact my state. I look forward to learning more about that from you today. I will say there was a bit of good news, I believe, last week when the national statistics of overdose deaths did go down. Rural health care is a top priority for this body. CDC data shows that rural Americans are more likely to suffer from higher rates of diabetes and are more likely to die from cancer, heart disease, and stroke than urban Americans. This is unfortunately true in my state, which also leads the nation in diabetes and heart disease. Improving rural health outcomes goes hand in hand with investing in the healthcare workforce to meet the physical and mental health challenges in America. HRSA has been a trusted federal partner on rural health issues for decades. HRSA has funded critical rural health capacity building and other initiatives across the country and administers the healthcare workforce programs that help bring medical providers into local communities. You have proposed moving HRSA into the new AHA, and is that how I say it? AHA. I would like to learn more about how your budget proposal would invest in rural America. We have a difficult task ahead of us, but it's my hope we can and will come together, just as we have done in prior fiscal years, to use our limited resources in the most efficient and effective way. So, Secretary Kennedy, I look forward to your testimony, and I now will yield to my, or not yield, but turn the microphone over to Senator Baldwin.
Thank you, Chair Capito, and I too look forward to continuing our strong bipartisan work together. Secretary Kennedy, today we are here to talk about your fiscal year 2026 budget request to Congress. You run a department dedicated to improving the health and well-being of every American. And these programs that you are responsible for administering touch the lives of all Americans at a critical moment in their lives, from research for life-saving cures and treatments for devastating diseases, to maternal health care, to child care, to addressing substance use and mental health. You have repeatedly pledged that you would run the department with, I quote, radical transparency. While this is a great catchphrase, it could not be further from the reality that we're experiencing right now, as we talked about yesterday. As required by law, a few weeks ago, the department sent this committee a plan for how it will be spending appropriated funds this year under the CR. But instead of providing Congress and the American people with any information about how the department is spending tens of billions of taxpayer dollars, there are only asterisks in place of spending levels for over 530 programs. In no other job under the sun can you essentially leave blank how you are spending billions of dollars. This is flatly unacceptable when we are talking about taxpayer dollars, and the people I represent deserve better. You are undertaking a massive and disruptive overhaul of the department. You are shutting entire offices down and firing thousands of experts. Your plan for all of this that you provided to Congress is little more than 1 page long. And that shows the chaos that this is creating. I'm assuming today you're going to reiterate talking points about how you are consolidating offices and eliminating duplicative functions. But Secretary Kennedy, this is a genuine request. Please sit down and talk to us in detail about what you are doing. Have your staff talk with our staff on both sides of the political aisle about your plans for the department and what you are doing right now. For a department this important, anything less is simply not acceptable. Let me turn to what it is that we do know about your budget request and what is happening at the Department of Health and Human Services. Your fiscal year 2026 budget requests cuts to the National Institutes of Health of $18 billion. That would have a devastating impact on research into life-saving cures and treatments for devastating diseases, setting back medical innovations by decades. It would push the brightest scientific minds to work in other countries. It would cede our leadership in biomedical research to China. It would also take away hope from millions of American families. For the family receiving a devastating diagnosis of pediatric cancer, like Charlie and her mom, Emily, who spoke to this committee last month, it would mean less hope. For Jesse, a veteran and a father with ALS, and his son, Dewey, who wants his dad to see him graduate from high school, it would mean less hope and less time. This budget says a lot about the priorities of this administration. And normally I could, disregard it as only a request. But it provides insight into what you're doing right now in fiscal year 2025. At the same time you are submitting this request, you are actively stopping billions of dollars in NIH funding for life-saving research, including on cancer and Alzheimer's disease. You are implementing changes right now that are ripping away hope and life-saving cures from American families. If you aren't already, I think this administration is heading down the road of illegally impounding funding across HHS. Mr. Secretary, your budget request also cuts funding for CDC in half. Today, you will allude to consolidating programs into a new administration for Healthy America. But you can't just slash funding, fire everyone, slap a slogan on a new agency, and say that work will continue. In previous years, I would have called this only a proposal, reassured by the fact that Congress would reject it and rewrite our own. But this year, right now, you are dismantling CDC, seemingly in line with your budget request. Congress did not approve that. On a bipartisan basis, Congress funded the CDC to administer programs that provide critical public health support to states and local communities across the country. That includes the CDC Childhood Lead Poisoning Program. When the city of Milwaukee asked CDC for help addressing a lead crisis in schools, CDC should be able to provide support and assistance because Congress appropriated $51 million for CDC to do its job to address lead poisoning. Despite what you told me last week, that you have no intention of eliminating this program, you fired the entire office responsible for carrying it out. So CDC told Milwaukee Public Schools that they simply couldn't help. Your decision to fire staff and eliminate office